This morning, we're talking about heart health and COVID-19. There's a number of different ways in which the two are connected. And joining me more to talk about those, happy to have on the show Theresa, Keddy, a physician assistant with ProHealth Physicians in Avon. Theresa, good morning. How are you today?
I'm good. Thank you very much for having me join you today.
Yeah, glad to have you here. Why don't we just start with some basic information about heart disease, just how prevalent it is.
Sure. So heart disease is the #1 killer for people in the United States. So it's very important to control heart disease early so that you don't end up as one of those statistics.
Yes, it sure is. Yeah, prevention always the best factor here. But what are some of the key risk factors people should be looking for with heart disease?
Sure. So there's some things that you can't control, like the increased risk of heart disease with age or family history. But certainly the most important risk factors that you can control would be your dietary habits and your exercise regimen. People that are sedentary are significantly higher risk for heart disease, as well as people that consume a diet that's high in fats and cholesterols as well. So diet and exercise play a huge part in that, as well as other health issues. So if you have high blood pressure, high cholesterol, diabetes, those are very associated with heart disease as well, those conditions.
Yeah, as we said, prevention is important, but what about when something might be a little more imminent? Are there warning signs of serious heart conditions that are more or less prevalent in everybody, or is it different from person to person?
So it is different. Some people, when they're experiencing a cardiac event, feel pressure in their chest or pain radiating to the back or neck or arm. And so that deep chest pressure or shortness of breath is classic, and they should seek medical care immediately. But some people, especially women or diabetics, unfortunately, the symptoms can be much more mild or generic as far as feeling just fatigued or slightly short of breath or dizzy. And so it is important to, early intervention and key so that you don't miss an event that potentially could go undetected.
And that brings us into COVID. Of course, I want to talk about what the virus can do to your heart, but you brought up a good point. A lot of these heart attacks, strokes, things that should stay constant, we started seeing a lot fewer people going to emergency departments and doctors' offices to get screened. Just how much of a problem was that during the early stage of the pandemic? And how important is it for people to get that screening done, especially if they've been waiting for a couple of years?
Right. And so we did see a lot of people putting off preventative health care and other routine things during the COVID pandemic, which is understandable, the concern about not wanting to leave the house or putting yourself at risk. But your doctor's office and or the emergency room is still the safest place to be. And it is important to catch those risk factors early. And so it's still important to keep up with your preventative care and any warning signs during the COVID pandemic.
And what can the SARS-CoV-2 virus do to the heart?
So we don't know, in detail yet because it's still slightly, early with COVID and we don't know the long-term effects, but we have seen people can get inflammation in the heart muscle itself, or they can have inflammation in the vessels of the hearts or vessels in other areas of the body. You're having decreased oxygenation when your lungs are struggling, and so decreased oxygen to the heart muscle itself, and that can cause damage. It can also cause arrhythmias, which is an irregular rate or pattern of the heartbeat itself. And these things could be temporary and recover during or after a COVID illness, or they could cause long-term heart failure or heart problems.
Yes, and you brought up a good point, Theresa. As far as discussing and trying to determine some of these long-term effects with long COVID, unfortunately, we're still very early in that stage. So we've already found a number of problems that virus can do to your heart, and hopefully we won't find any more. But thank you very much for taking the time to join us today just to talk about what people can do to keep their heart healthy. Thank you very much.